everyone, it's Lauren Ratcliffe again, and in this video, it's not necessarily about autism like some of the other ones are, but the title of it is Autism and the State of the Current Economy in 2025. For those of you that don't know, I was diagnosed with high-functioning autism in a time when it was poorly understood. That was back in the late 1980s, even though they did not name it as autism because I didn't meet enough criteria to be considered diagnosed with autism at the time. And in 1994, I was given the diagnosis of Asperger's syndrome when it was introduced into diagnostic criteria. In this video, I'm going to share my opinions and my experiences with stuff, and I'm not trying to change anyone's political views or religious views. I just want you to understand the state of the economy and how it could possibly affect our future. I disagree with everything that Robert F. Kennedy Jr. is trying to do with vaccines. Now, my views on vaccines is I believe that vaccines are an important way of staying healthy, and I believe that anyone should be able to get a vaccine for highly contagious respiratory viruses like COVID and flu if they want one. I have been receiving flu shots yearly since I was old enough to understand the dangers of getting the flu. And when COVID hit, I got every COVID shot possible that I could get. As for the vaccine issue pertaining to autism, I could understand why some people would think that their kid got autism over a vaccine, because when some childhood vaccinations are given, they're given around the time that autism becomes more noticeable. It's something that you were born with, and I will say this because after talking to my mom not too long ago about this, she said that she noticed differences about me that were subtle when I was a baby and before I turned old enough to get the MMR shot. Right around 2 years of age, like many other people, I received the MMR shot. And number 3, how I feel about our leaders. Whichever political side that you go to, I encourage people to vote for the party that is going to stand up for the health and well-being of America. And there is so much that I've always disagreed with when it comes to helping the poor and the needy people in our country, and unfortunately it's about to get worse because of our leaders. They're wanting to make it to support people that have got money, and the majority of the people around the world are poor. The number one on this, I disagree with the Medicaid limitations and the way they are also with SNAP, HUD, financial aid, and all that for students. And currently, in order to receive Medicaid benefits, you're not allowed to have more than $2,000 in assets or in any kind of bank account. And I disagree with how much you're limited on Medicaid based on what your abilities are, because they're all different types of disabilities. Some disabilities are invisible, others are more obvious. And if you're on the autism spectrum, it affects people differently. And it's crazy how it affects people differently. And it's the same disorder. Like, on one hand, you've got geniuses like Bill Gates and Steve Jobs, and then on the flip side, you've got people that are nonverbal and have to have support 24/7. The other thing about Medicaid is what I don't agree with it about is the limitations for married couples. If somebody makes so much money when they're married, their Medicaid benefits are cut and they can be struggling financially. As a Christian, I was raised in a church environment and was taught to believe that if a couple lives together, that they must be married. And I still strongly support that idea. Unfortunately, there's limitations for access to the appropriate health care that we need in America. And it's only going to get worse because they're closing down rural hospitals. And that's what we need. Our local rural hospital is an amazing hospital. I've gotten great care there when I've went. When I was a kid back in the 1980s, we had very limited access to get help and services for my autism. It was because doctors didn't know so much about it back then. It was also where we lived at. We had to drive all the way to Cleveland Clinic to get me a diagnosis. When children have any illnesses, parents have to drive 2 and 3 hours or more away to a pediatric hospital to get their kid help. I feel like all hospitals need to have access to specialists for people of all age groups. And abortion is an issue among religious people. I feel like if we stop the limitations on the federal programs, we can decrease abortions by helping women to receive important services regardless of their status. Because it's very expensive to go to the hospital, and one delivery can cost you a lifetime of earnings. So many people with autism are receiving disability benefits because the world does not understand their amazing talents. I feel like Medicaid and all other forms of disability programs should be expanded and shouldn't cut people out based on how much money they have in the bank, because there is non-medical emergencies that are going to happen from time to time, and occasionally Medicaid will not cover some services. And for anyone that can get sick, even if they got tons of money in the bank, it can wipe their savings out. And as for the closure of rural hospitals, it's also going to affect services for autism, because rural hospitals are often the places where people go when they first need care. And a rural hospital is going to be the one to know whether you need further care or not in anything. Also, another issue that concerned me with limitations on stuff is when I had a minor surgical procedure done at a hospital. There was our local teaching hospital. My surgeon had a resident student that was training with him, and that resident student, when he came and introduced himself before they got me hooked up and ready to go to surgery, he said that his wife had to quit her job because they could not afford daycare. And it was obviously because he probably made too much money as a resident. And that says about what type of services we need in America. I also disagree with the cutting of all federal educational programs. A good education is important to children on the autism spectrum. And if we have a good education, it can prepare us for a good future. Like Medicaid, federal programs for college students, and really any educational institution, should be increased. This includes programs for special needs students, scholarship programs, and so on. Programs for special needs students, all scholarship programs, etc., should pay for undergrad and graduate programs, and this includes, but is not limited to, all master's degrees through PhD levels, and programs like medical school, dental school, law school, and so on. And in conclusion, from a Christian perspective, we should put the poor people and special needs people first. And if we can do that, everything about the economy will be better off. This includes making sure that everyone, regardless of their socioeconomic status, race, age, etc., deserves prosperity, happiness, affordable health care, good education, and a fulfilling life.